I'm Margaret Curtis. I'm a pediatrician at Central Maine Pediatrics. There are wood ticks or dog ticks, and there are deer ticks. In my house we call them big ticks and little ticks. So dog ticks are about the size of an apple seed. They're pretty easy to find. Deer ticks are about the size of a poppy seed, and they're really hard to spot. Most people who get Lyme disease never found a tick. So whether your child has a bite or not might not tell you if they've been exposed to Lyme disease. Typically the tick has to be buried and engorged, meaning has some blood in it, to transmit Lyme disease, but it's not totally reliable. Oftentimes we look more for the symptoms. So symptoms of Lyme disease are the bullseye rash, which is classic, but it's not the most common rash. The most common rash is a red rash that kind of moves around. So it's in one spot and then a couple hours later it's moved a couple inches. If you see that, you should come bring your child in and we'll treat them for Lyme disease. Other symptoms later on include headache, muscle aches, intermittent fevers, so fevers that come and go, and just generally not feeling good. Much later signs of Lyme disease include swollen, painful joints, but we always try to catch Lyme disease before it gets to that point. So the best way to prevent ticks on kids or adults is to wear long clothes, tuck your pants into your socks, put your children in light colored clothes, make it easier to find ticks. And at the end of every day they've been outside, to give them a bath and do a good tick check, including in their hair, behind their ears. Ticks like to hide in places, so look under their arms, in their diaper area if they're little and still wearing diapers. You can use DEET. It is very strong, so I generally recommend putting it on kids' clothing rather than directly on their skin. Keep your lawn mowed. I don't usually recommend chemicals on lawns just because little kids will roll around in the grass and put things in their mouth, so it's hard to know what you're exposing your kids to. But if you keep your lawn mowed, that keeps the ticks way down. And if you have animals at home like dogs or cats, treat them appropriately. So if your child has a tick bite, the best and safest way to remove a tick is to use a pair of tweezers, get as close as you can to the head, and gently pull it out. Don't worry if a little bit of the head remains inside the skin, because the body will get rid of it, and you can't get Lyme disease or any tick-borne disease just from the head. If you see a little local reaction, like a little redness, just keep an eye on it, put a little antibacterial ointment on there. It's normal for the body to respond with a little bit of redness and swelling, but it shouldn't get red, hot, angry, or painful. If it does, come see us, because that could be a sign of a little local infection, and we would treat that. And then in terms of tick-borne diseases like Lyme, look for a red rash. It could be the bullseye shape, or it could just be a red blotchy rash that kind of moves around. Look for fevers, irritability, fussiness, achiness, headaches, a child who just seems tired, and talk to us about it. We may test at that point. Down the road, the long-term consequences of Lyme are things like swollen, painful joints, but typically what we see most often is kids with rashes. So dog ticks or wood ticks, which are the big ones, don't carry Lyme disease. So if your child's been bitten by one of those, you don't need to worry that they're going to get Lyme or some other tick-borne disease. You should still watch the site, because it can get red, it gets swollen. If it's painful, if it seems like it's tender to the touch, then bring your child in, because they might have a little local infection, but not a tick-borne disease.